Imagine this. You've just started your day. You're feeling great and you decide to move that heavy box that's been in the corner for a while. So you bend over, grasp the box, and as you stand, sharp, searing pain through your lower back. It's a sensation you won't forget, and it could put you out of work for days, weeks, or even months. And you wouldn't be alone. Back injuries are incredibly common, and they're often due to improper lifting. That's why it's essential we understand the mechanics of safe lifting. The Occupational Safety and Health Administration, OSHA, also mandates that employers provide a safe workplace under the General Duty Clause. Now, part of that responsibility includes training on safe lifting techniques. So today, we're going to discuss the biomechanics of lifting, how to plan for a safe lift, how to properly execute a lift, and how to recognize and respond to potential back injuries. Let's get started. Understanding how your back works is the first step to safe lifting. Your spine is a strong but flexible column of small bones called vertebrae. It serves as the body's main support structure, enabling us to stand up straight, bend, and twist. Between each vertebra are discs acting like soft, shock-absorbing cushions. When you lift, several muscles in your back, abdomen, and legs work together in a delicate balance. The powerhouses of the system are your leg muscles. They're designed to carry the heaviest load. If instead your back muscles bear the load due to incorrect lifting, it can lead to back strain and injury. When we talk about lifting injuries, we're particularly interested in the lower part of the spine, or the lumbar region. It already bears the weight of the entire upper body, and it's the pivot point when we bend or twist. Let's look at two common injuries associated with incorrect lifting: muscle strains and herniated disc. When we lift something that's too heavy or lift incorrectly, we can overstretch or tear the back's muscles and ligaments. This can cause immediate pain and limit your ability to move or to put weight on your back. As we've seen, the vertebrae in our spine are cushioned by small spongy discs. When we lift incorrectly, the increased pressure can force some of the softer material inside a disc to protrude out, herniating or rupturing the disc. Now, this herniation can compress nearby nerves, causing pain, numbness, or weakness in other parts of our body. Hopefully, by understanding the forces at play and recognizing the specific risk of improper lifting, we can avoid these injuries and maintain a healthy back. Next up, we'll discuss how to properly plan for a safe lift. Effective planning is crucial for a safe lift, and that begins with an understanding of the risk factors involved. The National Institute for Occupational Safety and Health, or NIOSH, has developed an equation to help us assess these risks and determine the recommended weight limits for a given task. Now, we won't go into the mathematical specifics here, but you can find online calculators that incorporate this equation to help you plan for safe lifting tasks. What's important is that you first understand the major factors at play when assessing the risk of a lift. The first and most obvious factor is the weight of the object. It's simple. The heavier the load, the more stress it puts on your body. Always test the weight before you lift, and if it's too heavy, don't be a hero. Either break the load into smaller units or ask for help. Consider a load's distance from your body. Now, the further the load is from your body, the more strain it puts on your back. Imagine holding a bowling ball close to your body and then holding it at arm's length. Now, which is harder? When planning a lift, consider how to keep the load as close to your body as possible. The height from where you lift and lower an object also matters. Lifting a heavy box from the floor up to a high shelf puts more strain on your body than lifting at waist height. When planning a lift, consider how you could limit the vertical distance of the lift by using an intermediate surface like a table or a trolley, and never lift a heavy object above shoulder level. Doing so puts unnecessary stress on your back and shoulders. Twisting is a huge no-no during a lift. Our bodies just aren't designed to twist and lift heavy objects at the same time. When planning a lift, consider your body's position relative to the load. To minimize twisting, make sure your toes, hips, and shoulders are all pointed toward the load, and remember to pivot with your feet, not your torso. Repetitive lifting, even of relatively light objects, can lead to fatigue and injury over time. When planning tasks, consider the frequency and duration of lifting. Is there a way to minimize the number of lifts or spread them out? Remember to factor in regular breaks for rest and recovery. Lastly, focus on coupling and grip techniques. Coupling refers to the connection between your hands and the object you're lifting. It's essentially how you grip or hold on to the object. Good coupling reduces the force needed to hold and lift the object, making the task safer and easier. When planning a lift, consider how you can improve your coupling, like by transferring loose or unstable objects into containers with handles, or by wearing gloves to improve your grip on smooth surfaces. It's important to note that these factors are all related to standard lifting activities and don't take into account scenarios like lifting while seated or in restricted workspaces. They're also designed for ideal conditions and don't take into account environmental factors like extreme temperatures or poor lighting. Now, this means it's important to assess your surroundings, check for adequate space, a clear path, and safe surface conditions. Finally, consider the role of tools and equipment in safe lifting. Now, while proper lifting techniques are key, supportive gear like back braces can add an extra layer of support for your spine during a lift. Hand trucks, dollies, and other lift assist equipment can also help you lift and transport heavy or awkward loads. So remember, planning is crucial for safe lifting. By considering these factors ahead of time and planning to use the right equipment, you can significantly reduce the risk of injury. Now, once you've planned your lift carefully, it's time to execute it safely by following these step-by-step instructions on proper lifting technique. Set a wide base of support. Position your feet shoulder-width apart with one foot slightly ahead of the other. Now, this stance maintains stability in all directions. Squat, don't bend. Get low to the ground by bending your hips and knees, not your waist. For a heavier load, try a half kneeling position with one knee on the floor and the other bent at a right angle in front of you. Maintain good posture. Look straight ahead, keeping your back straight, chest out, and shoulders back. Lift slow and steady. Like an elevator ascending, straighten your hips and knees to lift the load with your legs. Remember, your back is not doing the heavy lifting here. Avoid any twisting or turning. Hold the load close to your body, ideally at the level of your navel. Take baby steps. If you need to move or change direction, do it with your feet in small shuffling steps. Again, avoid twisting or turning your torso. Lastly, lower slow and steady. Safely setting down the load is just as important as lifting it. Like an elevator descending, keep your back straight, bend your knees, and use your leg muscles to lower the load. Think of it as the lifting process, but in reverse. Above all, keep in mind these three golden rules. Never bend forward to lift. Always squat using your hips and knees. Keep the load close and use your legs to lift. Never lift a heavy object above shoulder level. Doing so puts unnecessary stress on your back and shoulders. And avoid turning or twisting your body. If you need to turn, then pivot with your feet. Remember, take your time, prioritize safety over speed, and don't hesitate to ask for help when you need it. Part of safe lifting is knowing your body and understanding the signal it sends you. Sometimes it can be difficult to distinguish between normal muscle strain from a new task or routine and potentially serious warning signs. However, it's always safer to err on the side of caution when dealing with back health. Here's some common symptoms of a back injury caused by improper lifting. Sudden pain in the lower back, often accompanied by a pop sound or sensation. Pain that worsens with movement, especially during activities such as bending, twisting, lifting, standing, or walking. muscle spasms or cramps, persistent stiffness or aches that don't improve even after a few days of rest, difficulty moving or a compromised range of motion. Also, weakness or numbness in your legs can be a sign of a more serious back injury. It's important to note that these symptoms can also be indicators of other serious health conditions, not necessarily related to lifting. If you experience any of these symptoms or suspect a back injury, here's what you should do. Stop lifting immediately because pushing through the pain can lead to a more serious injury. Apply a cold pack to the affected area to reduce inflammation and numb the pain. Seek medical attention as soon as possible. Don't try to self-diagnose or treat a serious back injury yourself. A healthcare professional is the best person to provide you with the right diagnosis and treatment plan. Lastly, rest and recover. Give your body time to heal by avoiding strenuous activity and especially any heavy lifting until you're fully recovered and cleared by a healthcare professional. Remember, when it comes to your health and safety, it's always better to be safe than sorry. Listen to your body, respect its signals, and don't hesitate to seek help when you need it. And there you have it. We've covered the main topics of safe lifting, including the biomechanics of a lift, the risk factors at play when planning for a lift, how to execute a lift safely, and how to recognize and respond to potential lifting injuries. To wrap things up, this training can be summarized into 3 key takeaways. 1. Always plan your lifting task. Assess the weight, distance, and frequency of your lifts to ensure you can execute them safely. Now, this is especially important for lifting tasks that will be executed regularly. Take advantage of online tools for calculated recommended weight limits and incorporate supportive lifting equipment where possible. 2. Execute your lifts safely. Lift with your legs, not your back. Move slowly and steadily. Turn with your feet and not your torso, and never lift above the shoulders. 3. Listen to your body. If you experience symptoms like sudden pain, stiffness, or numbness in your legs, stop lifting immediately and seek medical help. Safe lifting is a skill we can all master through practice, and it's important to hold each other accountable through regular training and friendly reminders on the job. So, thank you for taking the time today to prioritize safety at work, and remember, keep lifting smarter, not harder.